is it like when you end up getting COVID and you've had all of that? What does it feel like?
Well, I tell you what, I think with being boosted and vaxxed, with the vax and the booster, the symptoms were for me very, very minimal. You know, I had a slight itchy throat, a slight cough, running nose for about the first couple of days. And then after that, I pretty much was fine. So I was adhering to the CDC protocols at that time, you know, standing down for 10 days. But now, you know, CDC has changed the rules, stand down for 5 days. And that's the new policy, for example, that we're not implementing at the city. But with the vaccine and the booster, my symptoms were quite minimal.
Okay. All right. Okay. So also we're seeing right now just these issues with the testing, and
Yeah.
the city has set up some testing sites, just like we saw before. And tell me, just bring us up to speed on all that, please.
Yeah, there's a huge demand for testing as we anticipated. So the health department resumed this testing locations today at the various multi-service centers. Tomorrow on Wednesday, we're going to, in working in collaboration with Curative, we're opening up a major testing site at Del Mar Stadium. That will have the ability to test about 1,000 people. It will be by registration for tomorrow at Del Mar. And then on Thursday, there will be another testing site being opened up at Minute Maid in Lot C. And then from this point through the end of January, what I've said to the City of Houston's Health Department, we want to work with as many partners as we can to ramp up testing, to make it as ubiquitous as possible, as widespread throughout the city as possible, so that people don't have to stand in lines for a long period of time. I would ask people for right now, or the next several days and even beyond, to be very, very patient, to be orderly. There are a lot of people who want to get tested, and that's good. That's good news. It's better to know than not to know, and that the city of Houston will be and already taking steps to ramp up testing such that you can find a free testing site throughout the city of Houston. But tomorrow, Del Mar Stadium, and then on Thursday, Minute Maid, Lot C, and then there'll be other sites that will be coming online. And this is in addition to all of the pre-existing testing sites, okay? So we will be ramping up testing quite a bit.
Okay. From what I understand, from what our managing editor told me before we started speaking, Del Mar's already full for tomorrow. So it's, I don't know what the capacity is for tomorrow. I think it's someone had said 1,000. Okay. So it sounds like, you know, it's going to be some tough days ahead, if not weeks ahead, right?
Well, over the next several days, Del Mar courses will be able to test 1,000 tomorrow, and that is by registration. On Minute Maid on Thursday in Lot C, I think they can test up to about 400. And then we were just visiting with some other vendors about having additional testing that will be even more widespread throughout the city of Houston. Those announcements, I suspect, will be coming forth over the next 24 to 48 hours. We already had the capacity to test about 27,000, but we are now expanding that capacity even more so. There is a huge demand. A lot of people, for example, who didn't travel out of town are wanting to be tested, though they're in town. There'll be people over the next day, next week, that'll be coming back from their holiday travel. They will want to be tested. And so the instruction that I've given to the City of Houston Health Department is working in collaboration with our partners to exponentially ramp up testing from now through at least the end of January and possibly even beyond that. So you are going to see more testing sites that will become available free. And I want to emphasize that for people, that will become more available throughout the city of Houston, starting tomorrow and over the next days and weeks.
Okay. We got an email from Harris Health about half an hour ago that's asking people if they don't have severe COVID symptoms to please avoid the ERs if they want to be tested or treated. What is the situation like at the hospitals right now that you're seeing or being told?
Well, the number of people who have been admitted to the hospital, that number has risen. I look at the numbers almost every morning. The last number I saw, and well, I don't even want to mention that number, but the number of people in our hospital, that number has increased. It is still significantly below that surge rate that we saw in the previous surge, which is good. So there are a lot more people who are being infected, and let's say with this new variant. But still, in terms of the number that are going to the hospital, it is not as high as in the previous surges, but those numbers are increasing. So if you don't have any serious symptoms, I will agree, please don't be heading to the hospitals and taking up that limited space there. And that's why we want to do everything we can on our end to provide as many testing sites as possible throughout the city of Houston. Just be a little bit patient with us as we ramp up those additional testing sites. And in most cases, I do want to emphasize the importance of being vaccinated. Okay, for those who have been vaccinated, please get that booster shot. That will help to keep you out of the hospitals, and that's a big thing. So if you've gotten the vaccination, Moderna, Pfizer, 6 months have elapsed, please get the booster. J&J, 2 months have elapsed, please get the booster. That will help quite a bit and will help to maintain capacity within our hospitals. And then please continue to put on your mask if you're around people, especially if you're experiencing any type of symptoms or no symptoms at all. If you're around other people, please put on your mask and keep your mask on. But if all possible, unless you're experiencing some serious symptoms, I would avoid going to the emergency room or going to the hospitals.
And one of the other things that they'd alluded to was that now, doctors and nurses are starting to get sick. And so then they have to go into isolation. Are you seeing many shortages right now, or I guess we can just expect them to come?
Well, I will tell you, I can speak from the city's point of view. We have more municipal workers, more police officers, and more firefighters that have come down with COVID than I've seen in the last several months. Okay. The last number I saw that were in is 474, for example, city employees, over 200 police officers, 200 municipal workers, and probably about 80 firefighters, and that number is increasing. And that's why we have changed, as of today, for example, I've changed the executive order. Instead of standing down for 10 days if you test positive, if you test positive, you will stand down for 5 days, because it is important. We still have a city that has to function, has to work. Operations still need to take place, but we also want to protect our employees, and we want to protect people that they are around as well as their families. So we will adhere to the new CDC guidelines. And I suspect what I am seeing within my own employee base is also happening at our hospitals. Doctors, nurses, respiratory therapists are all on the front line. And that's why it is important, for example, for people to get that third dose. That's important. It is important for people to get tested to make sure that they're not spreading the virus to other people and to their family members, friends, and co-workers. And it is important for all of us, when we're in the presence of other people, to put on these masks. I mean, we will get through it, but I suspect this surge will continue to ramp up into January. And then hopefully, by mid to late January, the numbers will start to come down. That's my hope.
All right, very good. Anything else that you want to add, Mr. Mayor?
Testing, I just want people to know, we already had a number of testing locations, but in addition to those that we currently have, we are taking steps to ramp up the testing. And so I know there are people, for example, that have been standing in lines for, let's say, a couple hours or so, and then the slots are taken. I know that can be very frustrating. So let me just ask people, for at least for the next few days, just to be patient with us as we ramp up testing, and we are ramping up testing, but be patient while you're in line. Don't be cutting the line. Let's be respectful and courteous to one another. And if we do that, we will get through this together. So this is another surge. The good news is that if you're fully vaxxed, the symptoms don't appear to be nearly as severe, and you can avoid the hospitals. And again, I don't want to give up on anybody. If you haven't been vaccinated at all, I'm still going to encourage you in the humblest way that I know how. is to get vaccinated. And for those who are, make sure that you get your booster.
All right. Very good. Thank you so much for your time. I appreciate it.
Thanks. Stay safe out there.
Okay. Talk to you later. Bye-bye.
Okay. Happy New Year.